mentioned the Meaningful Use Program and the Affordable Care Act and the interoperability standards associated with that. I was wondering if you could comment on the lack of infrastructure to really accomplish that interoperability, particularly for health information exchange, lack of a real infrastructure as far as health information service providers, and what HIMSS as a lobbying organization might be doing to help us explain the complexities there to the government.
Yeah. Infrastructure is a real challenge, and some of it I alluded to in the remarks. There is very much digital divide, not only between geographic areas, between the economic capability of provider organizations in the city, Medicaid, heavy hospital versus a university-based academic center that may have a far greater foundation that can invest greater in that infrastructure. One of the things that we've worked on for years is dealing with the first part of that, which is standards. Healthcare technology developed in an era where nobody paid any attention to setting a single way, just to simplify and get out of technical terms, a single way of doing things. Everybody did their own way. Systems didn't match up. And we're now having to undo that. So I think the first real infrastructure question is getting past that barrier. I think the technology itself, the technology infrastructure, is getting there as we improve on the issues I touched on today related to speed and bandwidth. But I think the real significant barrier that we're still going to be dealing with is that of cost. The investment in all of this is extremely great. So back to our efforts as an advocacy organization, we've worked very hard in that legislation that passed in 2009, which for the first time gave provider organizations funding for managing information. Doctors and hospitals have always been paid for delivering care, but there was no way to get any reimbursement for managing the information that came out of it. That was just something you had to figure out how to pay for some other way. So with the Affordable Care Act, funding came in and continues here for a few more years to help get people to that point. We've still got great challenges and great barriers, but I think if you look at the statistics in terms of where hospitals and doctors are today versus where they were 5 years ago, we've made tremendous progress to that point of actually being